Hey everyone, Dr. Alex Ritzy here, and today is all about elbow pain. We're going to be talking about tennis elbow, golfer's elbow, all sorts of types of elbows, with the goal today of hopefully helping giving you the resources that you need to get some relief and hopefully correct the underlying problems that are contributing to your elbow pain. When we see elbow pain in the office, whether it is medial or golfer's elbow, or lateral elbow pain or tennis elbow, usually by the time that there is pain there, there's been a lot of changes at the elbow, in the spine, and sometimes in the nervous system that actually occur before the pain even begins. That's why with elbow conditions, it's usually a much more complicated problem than just having pain at your elbow. So what we're going to discuss today is the underlying cause of some different types of elbow conditions, and the reason we should discuss it is so that you understand why there are a lot of different things that need to be done in terms of corrective exercises, preventative measures, and if you end up having to see a professional, why a really comprehensive look at the body and treating the body as a whole is really, really important, and sometimes the only way to help with different elbow problems. So let's get into it. Okay, so if you're watching this video, you probably have some pain in your elbow, or you want to have pain in your elbow. So let's talk about some of the different things that can happen with the elbow and what it really means. When most people come to see us at our practice, usually we encounter a lot of outer elbow pain or lateral elbow pain. Technically we call it lateral epicondylalgia, which means pain at the elbow. People typically know this as tennis elbow. Now, a lot of people think they can't have it because they don't play tennis, and that's why the name is something that we rarely ever use in the office because it's a bad misnomer. Most people that we encounter in the office get lateral elbow pain from living the desk life, from having poor ergonomics as one cause, but often this elbow pain, and this is really well supported in the research, is typically not just or not a problem at all with the elbow, but rather a problem with the spine and or the nerves that go down to the elbow. So if you have a typical case of tennis elbow, and sometimes if you have a typical case of golfer's elbow on the inside, there's usually a number of different changes that have happened. Usually we encounter there's a lot of tightness in the forearm muscles from having poor ergonomics, where you are maybe holding the wrists up in an angled position, which is going to activate these muscles all of the time. This tightness here is going to yank on the tendon that attaches to the bone, and over time that can cause some chronic degenerative tearing or some chronic inflammation. Now, the research shows us that this condition rarely ever occurs without the neck's involvement, and definitely in my experience with the nervous system's involvement with the nerves that travel down into the elbow. What the research shows us is that this condition typically occurs when there is a sensitivity or sensitization of the nerves that travel down to the elbow. So how do we know this? Well, if you look at a number of different people in a study, it's really common for people to have tearing here on an ultrasound or an MRI, or have the same degenerative changes, but only some people have pain with this condition. And so what we know is that people who have tearing or degenerative changes here, it seems that the nervous system has to be sensitized or irritated in order for this condition to become painful and for you to eventually become aware and know about it. So, in my experience, whether we're talking about outer elbow pain, inner elbow pain, or even just tightness through the forearms, we usually also find there to be a problem with the neck. That could be poor movements of the joints putting stress on the nerves, or a significant structural change where you get that structural shift forward in the neck. And that's often also compounded by additional stress on the nerves, leaving the neck and the muscles, that radial nerve in the back of the arm right there, and sometimes additional stress in the tricep muscle, so that by the time the nerve travels down to the elbow, it's really, really sensitive, and if there's any problems here at all with the tissues, it's going to be quite sensitive to that, and very ready to send a pain signal up to your brain telling you that there is a problem. So, if you have elbow pain, it's really, really important to, first off, understand what type it is in terms of what tissues and structures are involved. And then, number two, identify if there's some sort of problem, or what we call a core problem, in the spine and the nervous system elsewhere that might be actually the underlying cause of this, or at the very least, making it worse. So what we're going to do with this video is we're going to assume that you have a problem with your spine and nervous system. We're going to assume that there's also a problem here in the elbow, and we're going to give you some exercises and drills that you can do at home to try and help give yourself some relief, or maybe even correct this problem yourself. The big caveat with this condition is I find that if you do not take a comprehensive approach to having this managed, it often never goes away. In our office, we see it year after year. People come and see us for tennis elbow or some sort of elbow problem, and they've been to everybody or been to a more traditional chiropractor or the massage therapist, and it gets a little bit better, but it never goes away. And often the thing that is missed is the connection with the neck and the extreme importance of the nervous system with any sort of elbow issue. We'll also discuss some ergonomic concerns. So we got a lot to go over, so let's go into some of the ergonomic things before we get into any of the exercises. So in terms of ergonomics, we want to make sure that if you have a desk job, there's a minimal amount of stress on the tissue at the elbow so you don't keep recreating this problem. So a couple things to remember. If you're having some elbow pain, or if you want to prevent it, make sure that the elbow, as much as you can, is always supported by an armrest on the chair. That way, you're not going to have to hold the arm up with your shoulder muscles, and of course I'm exaggerating here, because that's going to put a lot of stress on the nerves leaving the neck and the nerves that eventually come down to the elbow. The other really simple thing is that when you're working away, you want to make sure that not just is that arm supported, but hopefully the wrist is supported either sitting on your laptop or is being supported by some sort of keyboard tray. What we don't want is the arms hovering or the wrists hovering like this, because that's going to put a lot of stress on the muscles in the forearm, asking them to hold either the whole arm or the hand up all day like they're holding up a sledgehammer, because after years or decades of doing that, that's what they're really doing. It's going to create a lot of stress through these tissues. Now, in terms of our stretches and our exercises, let's deal with that stuff first. So, whether you have a desk job or some sort of job that you find you get a lot of tightness through the forearms, or you have one of these elbow conditions, a couple of simple stretches we want to do. Hand out, and we want to bring the hand in towards us. We're nice and soft through the shoulder, taking nice, easy breaths in and out. And then what I like to do with this stretch is bring the pinky inwards, so I'm rotating it towards my belt buckle, holding for a little bit, and then I can also rotate the hand outwards. So head on, rotating that pinky and pulling in towards the belt buckle, and then out away from the belt buckle or away from the body. From this angle you can see out, so this would be in towards the belt buckle or out away. This stretch you can hold anywhere from 30 to 60 seconds, making sure that when you do it, you feel a nice stretch in through the forearm. You might even feel it in the elbow where you're having that discomfort. Of course, we want to work on the flexors as well, and this is where we're going to bring the hands or the hand down and away, and this is where we can also rotate the hand inward towards the belt buckle or outwards away from the belt buckle. So this would be in towards the belt buckle or out away from the belt buckle. Now, sometimes if you're a really flexible person, or for some other reason you don't get a stretch with either of those, often you can dig your arm in or bend the arm, put it against your chest, and try the same stretches, and that will typically help. So this is another modification you can do, where if you bring the arm in and put it along the side of the body, keeping it flexed, that can be a good way to get a stretch through those forearm muscles. What we're going to do next is now we're going to travel up along where that radial nerve is that's often involved with the tennis elbow or lateral elbow pain, and this, a simple stretch. hand out straight, bring it across the body, take nice easy breaths, and we can hold that for 30 to 60 seconds. What this is going to do is it's going to stretch the tissues and that radial nerve that's often involved there and give them a little bit of relief. Now with this, what I also like to do is you can see you can rotate the hand, and you can either rotate it dynamically like this or rotate it all the way in and get a stretch, or rotate it all the way out and also get a stretch. That rotation is going to again target different tissues and move that radial nerve around. Now, another thing that you can do is if you're not getting a stretch weight there, or you're stretching and no matter what, it's really tight and really sore in the back of the arm, what we can do is we can get our lacrosse ball. And this is where you're going to put the arm here just behind the armpit, and you're going to roll this either along the floor or up against a wall. And when you roll that up against the wall, you want to have it right in there. You might even get some tingling or some pain down the arm that travels down to the same elbow. That's okay. We want to roll that for, again, anywhere from 30 seconds up to a couple of minutes. Keep the intensity, or the pain intensity, somewhere between a 4 and a 6. Don't go too hard, but you also want to be able to feel it. Next, what we want to do is we want to address some of the potential problems with the neck. And there's a couple different stretches, but I'm going to go to my favorite. That's our chair stretch. And we've gone over this before. That's where you grab onto your chair, lean your body, and then lean the neck. And this is again going to stretch out not just some of the neck muscles, but you'll get a little bit of tension through that radial nerve, taking all the slack out, bringing the neck over. If you want to be really specific, you can rotate the neck a little down, and that'll definitely get that radial nerve back there. Nice, easy breaths. Holding that for 30 to 60 seconds, and that's going to help loosen up the muscles and hopefully the nerves that travel down to the elbow. Now, if you have inner elbow pain, that's where it can be a bit more complicated. There's a number of different nerves that can affect it. Often it's the ulnar nerve that travels behind it, and in general what I would do if that's your issue is I would do a pec stretch in the doorway, where you're leaning into the doorway, hand is there, stretching out the muscles here through the front. Or you can again target the nerves right in here, get your lacrosse ball, and either on the floor or up against the wall, put that ball there just inside of the armpit, below the collarbone, and try and dig into the pectorals there, because that's often where the ulnar and radial nerve travel down into the arm. So those are the corrective exercises we give to our practice members when they're going through some sort of elbow issue, and they work really, really well. If you find that these are helping, but don't help all the way, or that they do nothing at all, that's where you're going to want to come and see us or seek some other professional opinion. And please, guys, do me a favor, if you have this issue and the person you're seeing has not looked at your neck, has not looked at the nerves leaving the neck, has not looked at the shoulder, you might want to get a second opinion, because it's likely that they're probably missing something. If they've looked, if there's no core problem with the spine and nervous system that might be contributing to the collateral damage in the elbow, that is great. But just make sure that whomever you're seeing is looking to where the core problem might be in the spine and nervous system, so that they can address that, so that you're not just dealing or band-aiding the symptoms. I hope that you guys got a lot out of this video. Please share it with a family member if they need it, like it, and I will see you guys next week, and we'll go over some more great exercise, movement, and recovery drills to help you get as healthy as you can.